Welcome back to another Explainer. Today we are tackling what honestly seems like an impossible logistical puzzle. How do you deliver state-of-the-art healthcare to communities that literally shift and move with the tides? Well, we're going to see how a visionary NGO in Bangladesh turned this immense challenge into a real, sustainable, floating reality. Because, sometimes when traditional infrastructure completely fails, you just have to float the solution right to the patient's doorstep.
Okay, let's dive into this. 6 million. Just hold that massive number in your head for a second. In Bangladesh, this represents the estimated population living on isolated, constantly shifting river islands. These unique temporary landmasses that just pop up in the middle of the waterways, they're known locally as chars. 6 million people. That's literally more than the population of many entire countries, living their whole lives on fragile, temporary ground that is completely cut off from the mainland grid, no electricity, no roads, and most importantly for us today, zero reliable healthcare. To truly wrap our heads around this logistical hurdle, we have to look at the sheer scale of the Bangladesh Delta. We're talking about a wildly complex, interwoven network of 405 rivers. 57 of those are transboundary, meaning they share borders with India and Myanmar. The lives of millions revolve entirely around these waters. But this landscape is incredibly vulnerable to severe flooding and constant riverbank erosion. And because these chars are just so isolated, tiny traditional boats called khayas are often the absolute only way to get around. So, building a permanent brick-and-mortar hospital out here, geographically, it's pretty much impossible. So naturally, this geographical isolation creates a pretty heartbreaking socioeconomic divide. If you're in an urban area, private hospitals offer world-class modern treatment. But let's be real, that's almost exclusively for wealthier individuals. Now contrast that with the rural char dwellers. For those 6 million people we talked about, the situation is incredibly bleak. They are totally detached from viable care. This leads to tragically high maternal and child mortality rates. We're talking about untreated infectious diseases and common everyday ailments that escalate into life-threatening conditions simply because, well, there just isn't a doctor anywhere nearby. And this stark divide really brings us to a fundamental question about how we value human life. The Nobel laureate Amartya Sen actually hit the nail on the head here. He said, "The notion of human right builds on our shared humanity, presumed to be claims or entitlements of every human being." Basically, access to medical care shouldn't just be some privilege tied to your zip code or, your proximity to a permanent landmass. It's a fundamental societal right. Yet millions of these riverine people have historically been entirely shut out from this right, purely because of poverty and geography.
Now, what's really interesting about this slide is how an incredibly unlikely partnership sparked a total healthcare revolution. Back in 1994, a French sailor named Yves Mouret navigated a retired oil barge all the way from France to Bangladesh. I mean, you definitely wouldn't normally equate a grimy old oil barge with sterile healthcare, right? But Yves partnered up with a local visionary named Runa Khan, and together they founded the Friendship Organization. By 2001, with corporate backing, they brilliantly transformed that French barge and launched it as the Lifebuoy Friendship Hospital. It was such a massive hit that in 2008, they launched the Emirates Friendship Hospital. And then, in 2012, they actually bought a decommissioned Greenpeace ship, the Rainbow Warrior II, and launched it as the Rangdahonu Friendship Hospital.
And listen, these are not just simple floating clinics handing out bandages. Not at all. The primary and secondary services they offer are incredibly comprehensive. We're talking everything from antenatal care and pediatrics to specialized eye and dental surgeries. As these ships cruise the rivers, they bring in a constant flow of local and foreign volunteer doctors. It's amazing. Today, the broader friendship programs serve an astounding 3 million patients every single year. The ships themselves, they're treating roughly 175 people per day each.
The absolutely crucial point here is the sheer level of sophistication they're bringing to the absolute middle of nowhere. These vessels are packed with fully equipped surgical theaters, dispensaries handing out free meds, pathological labs, x-ray rooms, and even 8-bed recovery wards. And how do they staff it? Well, they fly in volunteer surgeons to perform complex orthopedic and reconstructive surgeries. Keep in mind, they're doing this in regions where basic clean water and a stable electricity grid are literally non-existent. It's truly a mobile marvel of modern medicine.
Let's move to and see how this builds, because Friendship didn't just accidentally succeed. To understand why this floating model works so flawlessly, academics use a service delivery model called the 4 A's to evaluate healthcare access. It stands for affordability, availability, acceptability, and awareness. This organization systematically conquered every single one of these 4 massive hurdles that traditionally keep the rural poor completely cut off from the health system. So let's break them down.
Okay, first up, affordability.
You've got to remember that Bangladesh is home to millions of the world's bottom billion who live below the poverty line. For these folks, cash flow is just an immense, often totally insurmountable barrier to getting proper healthcare. Friendship tackles this financial exclusion head-on. Not only do they provide these complex healthcare facilities and surgeries for free, or sometimes just for a tiny nominal token charge, but their onboard dispensaries also hand out vital over-the-counter medicines entirely free of cost. Boom. Financial burden lifted instantly.
And this brilliantly illustrates our next A, because cheap care means absolutely nothing if you can't physically get to it, right? That brings us to availability. The standard rule of thumb, the push-pull boundary of distance, basically says if a hospital is too far away, a sick person just isn't going to go. Friendship completely shatters this boundary. Ships like the Lifebuoy physically sail up the rivers and dock right at the muddy banks of these isolated chars. And for the bigger vessels that maybe can't dock directly on the shore, they run a constant shuttle boat service to ferry patients right to the floating hospital. They've literally made the hospital come to the patient.
Yet, even if a hospital is completely free and parked right on your island, people still won't use it if they don't trust it. That is where acceptability comes in. For modern medicine to actually work here, it has to align with the prevailing local cultural norms. If it feels foreign or intimidating, people will just avoid it. So Friendship builds trust from the bottom up. They hire directly from the community, local paramedics, trained traditional birth attendants, and female health workers known as Shastyashevikas. By bringing trusted local faces into the medical process, all that advanced, high-tech care on the ships suddenly becomes socially acceptable and deeply trusted by the char dwellers.
The final piece of the whole puzzle is awareness. Because think about it, you can park a world-class hospital on the riverbank, but if people don't understand their own symptoms, they're not going to seek help until it's way too late. Friendship runs these incredibly proactive, continuous education campaigns. They've set up training centers, family planning outreach, basically maintaining super close contact with the community. They are actively teaching these riverine populations to recognize the early signs of disease, giving them the confidence to go get the advanced care that is now literally waiting for them right out on the water.
As we wrap up this explainer, I really want to leave you with a provocative thought. What we've looked at today is a literal lifeline for 6 million riverine people in Bangladesh. But consider this for a second. Over 75% of the entire global population lives within 100 miles of a port city or navigable waterway. If a repurposed oil barge and an old Greenpeace ship can successfully deliver complex surgeries to the most isolated, impoverished river islands on Earth, how could this brilliant floating model be replicated to solve massive healthcare gaps in other isolated regions across the globe? It's a pretty powerful blueprint for the future of global health. Thanks so much for learning with me today, and as always, keep asking the big questions.